Croeso mawr i'r sesiwn holyg ateb ar Deintyddiaeth, Meddygaeth a Milfeddygaeth. Dentistry, Medicine and Veterinary Sciences. There are loads of questions for us to answer today. Well, for you to answer, my panel members. I'm just asking the questions, you're delivering the answers. So let's get to know who the panel members are. I'm going to go to Glenn to start off. Please introduce yourself, Glenn.
Oh, hello there, bore da. My name's Glenn and I work for the University of Bristol. I don't teach on any of the subjects, but I'm a former teacher and head of sixth form, and I work in school and college liaison, advising people about how to make successful applications. I have been particularly linked to health sciences, so I know a fair bit about how to apply, particularly considering things like contextual offers and also our gateway courses. And I'm very happy to be with you today.
So we better behave, we've got a teacher in the room, so look out. Diolch, Glenn. I'm going to go to the student next, Lauren. We can't hear you at the moment, Lauren. That's fine.
Sorry, I was on mute. Hello, my name's Lauren Molyneux. I'm a third year medical student at Cambridge University and I'm from North Wales, Bangor.
Diolch yn fawr, Lauren. Nawr at un o'r panelwyr Cymraeg, Menai Evans. Nid i gyflwyno dyna. Please introduce yourself, Menai.
Pnawn da bawb, hyfryd ymuno efo chi pnawn 'ma. Menai dwi swyddog pwnc iechyd a gofal i'r Coleg Cymraeg Cenedlaethol. I'm Menai Evans, Subject Officer for the Coleg Cymraeg Cenedlaethol.
Diolch yn fawr, Menai. A'r Gymraes arall, Sarah. Sorry, meddwl gynnu, Sarah.
Pnawn da, Sarah Vaughan, rheolwr datblygu'r Gymraeg yn Ysgol Feddygol Prifysgol Caerdydd. I'm the Welsh Language Development Manager in Cardiff School of Medicine.
Diolch yn fawr iawn ti, Sarah, and your fellow Cardiffian colleague. Let's go to Dave.
Hi there, my name's Dave Wilson, and unlike Lauren, I'm a first year in the medical course. No, I'm joking. I'm the Director of Admissions at the medical school in Cardiff, and I've had quite a lot of experience in guiding students to the medicine particularly, but happy to be here. Thank you.
Diolch yn fawr, Dave. And last but not least, our London colleague, Jonathan. Oh, your university's in London anyway.
Yes. Hello, everybody. Yes, Jonathan Turner. So I'm a teacher of prosthodontics, which basically means replacement of missing teeth. And I am Director of Admissions at the Faculty of Dentistry, Oral and Craniofacial Sciences at King's College London.
Gwych, diolch yn fawr. Now, we've got lots of questions here to pose to you, and if they're not quite relevant to you, maybe there's a generic response you can give to some of them. But hopefully we'll go between the different disciplines during the course of this session. And I want to start with a question about the application process in a way. So what's the process of applying for a medical university? And I'll start with Glenn.
Thank you. Well, the process at Bristol isn't unique, but it is quite different from some universities, and it does vary from med school to med school. So as you start to narrow down your choices, it is worth investigating this on their website or by talking to folk like us if you can. In the case of Bristol, we won't be scoring your personal statement, which I know is very important in some applications. But essentially, whatever the process is, the same things are going to be assessed at one stage or another in the process all the way through. So we're going to look for a certain level of academic ability. That's usually done through your grades. And it's worth interrogating whether they're asking for specific GCSE grades or A-level grades. Make sure you've got the right subjects, and will they consider resits? We, for example, will consider resits if your GCSE grades don't match what we asked for, but not everyone does. You look at those things, and then it's what's going to happen in addition to the grades in the application. So, as I said, for Bristol, we wouldn't be looking at your personal statement. We'll be ranking you for interview by your score on UCAT, which is one of the two main clinical aptitude tests that are out there. And then usually, in non-COVID times, the people who score well on that will be invited for an MMI interview, which again is something increasingly used by med schools across the country, but they will all interview in one way or another. I suppose that's the point really, that the process slightly changes, but the thing to do is is be assured that you're going to be tested for the same skills, your aptitude, your interest. You'll be given the opportunity to talk about work experience if you've had the fortunate chance to get any in 2020, which we're all very aware is not normal, not easy. But the process will be slightly different, usually involving the personal statement for some, and then the aptitude test, an interview, and the right grades and other entry requirements. It's a bit different at Bristol for medicine and dentistry and veterinary science, hopefully.
But that's interesting to know at the onset that it's not just one-way traffic for each section of the sciences. So, Jonathan, what from your perspective, what's the process there?
Well, I think Glenn has pretty much answered the answered the question for me as well. I mean, almost identical to what Glenn said. I mean, from the dentistry perspective at King's College London, we'll ask for UCAT scores, and then we get the UCAS form in. We don't score personal statements. We look at the personal statements, but we don't actually score them. So we're looking to see what's on there in terms of demonstration of an understanding about dentistry as a career, for example. We'll be looking at GCSE performance, predicted A-level grades, and then on the back of all of that information, decide who to call to interview. And then again, in non-COVID times, we undertake MMI interviews face-to-face. This year, we're doing an online version because of COVID. But as Glenn said, every dental school is different. So my advice would be to look carefully at the websites of all the different dental schools. Most ask for UCAT. There are one or two that may ask for BMAT, for example. So decide which schools you're thinking of applying to, and then see exactly what it is thereafter. Some schools perhaps will put more weight on different things. So some schools, for example, will put more weight on UCAT than others. And so if, for example, you get a fairly relatively low UCAT score, then you may want to think about applying to schools that don't put so much weight on the UCAT score. And so that would be my sort of my advice.
Diolch, Jonathan. Dave, what's happening in Cardiff?
Thanks, Glenda. Well, just to echo what both Glenn and Jonathan have said, but one of the things I do is I always give a tip at the beginning of any discussion about applying to medicine. And the tip is, and if for any of your listeners out there or people watching, is to get a pen and paper and write down a Medical Schools Council, because there is a resource called the Medical Schools Council Entry Requirements. It is one document, searchable, or you can pull it down as a PDF if you're old-fashioned like me and like paper in your hand. But the point being is that you can do exactly what Jonathan and Glenn have just said. Look through each of the medical schools, and this is only for medical schools, obviously, and identify what it is that the entry requirements are for that particular medical school. So, for example, in Cardiff, unlike Bristol, we do read the personal statement. It has some influence on whether we interview somebody for entry into the course. We just use GCSEs. We ask for UCAT, one of these aptitude tests, but at the moment, we don't use it explicitly to threshold out. We tend to use GCSEs as our entry. So as Glenn and Jonathan have both indicated, there are nuances in the system. For those applying for medicine, please go to the Medical Schools Council website. Now, the only thing is, I don't get paid for saying that. That's the first thing to say. The second thing is, it's all free. And that's, I'm beginning to look like Trump waving hands around, but the point is it's all free. And it's written by people like me. So it's the admissions directors in the university medical schools that compile this data, and it is free to access for anyone. It's not privileged, it's for everyone. Enough. Thank you.
That's brilliant to hear, Dave. And for you young people watching and listening this afternoon, such a wonderful source of advice there for you. And it's free to those of you who are careful with your penny pinching. Menai, pa gyngor I chi'n rhoi yn y Coleg Cymraeg? I'm just going to ask Menai about what the Coleg Cymraeg, what advice at the early stage mae'r Coleg Cymraeg yn rhoi I fyfyrwyr.
Diolch, Brenda. Wel, swn i'n ategu be mae pawb wedi dweud yn barod, deud y gwir. Mae gwaith ymchwil mor bwysig, a fel mae pobl wedi awgrymu'n barod, mae pawb yn chwilio am rhywbeth gwahanol, a mae pwysles gwahanol mewn gwahanol sefydliadau. Felly mae'r gwaith ymchwil yn ofnadwy o bwysig. Mae'r Coleg Cymraeg Cenedlaethol yn rhedeg 2 gynllun o ddiddordeb yn y meysydd yma, cynllun doctoriaid yfory a cynllun deintyddion yfory. A mae hyn ar gael i bawb yn blwyddyn 12 dros Gymru sydd hefo diddordeb mewn ymgeisio. A mae'r cynlluniau yma yn dal eich llaw chi mewn ffordd drwy'r broses ymgeisio. Felly, swn i yn awgrymu, os ydych chi'n siarad Cymraeg a bod chi eisiau help a gynnwch chi ddiddordeb o'n astudiaeth deintyddiaeth a meddygaeth, bod chi'n ymuno hefo'r cynlluniau yma. Ac fel mae'n digwydd, da ni'n recriwtio mis yma. Felly gwyliwch allan am recriwtio ar gyfer y 2 gynllun yma. Ond fyswn ni jyst yn licio canolbwyntio ar y ffaith bod gwaith ymchwil mor bwysig, ond hefyd dweud bod yna help ar gael.
Gwych, Menai. What Menai was telling us there was, I guess, the real pivotal importance of research. And as you alluded to, the 3 of you, obviously, she agreed with everything that you said and then endorsed the importance of starting early, doing your research and finding out, for instance, what the Coleg Cymraeg can offer the Welsh-speaking students. Sarah, before I come to Lauren, we haven't forgotten about you, Lauren. Oes there rhywbeth, is there anything else you want to talk about the Welsh language students coming through Cardiff during that process?
Ie, mae yna lot o opsiynau a pethau pwysig sy'n ni eisiau nodi ynghylch y Gymraeg. Y peth cyntaf, wrth gwrs, ydy bod hi'n bosib i astudio 30% o'ch cwrs trwy gyfrwng Gymraeg. Ac hefo hynny, mae hefyd yn bosib ystedd yr MMIs trwy gyfrwng Gymraeg. A rwan un peth sy'n ni yn hoffi rili pwysleisio fama, ar gyfer unrhyw un sydd yn falle bod i Cymraeg nhw ddim cystadlau Saesneg nhw, neu vice versa, a bod nhw'n poeni am ei gallu ieithyddol nhw, dydy astudio unrhyw beth trwy gyfrwng Gymraeg ddim yn mynd i olygu bod chi'n cymhwyso yn unig trwy gyfrwng Gymraeg. Yr bwriad yn y pen draw, bob tro hefo astudio ac trwy wneud unrhyw beth o asesiadau neu cyfweliadau trwy gyfrwng Gymraeg, ydy bod hynna'n feddwl bod chi yn gallu mynegu'ch hunan y gorau phosib a bod chi'n teimlo bod chi'n gallu defnyddio pwy bynnag iaith ydych chi eisiau, a byddwn ni byth ddim ar adeg o recriwtio na chwaith pan ydych chi yn y brifysgol yn asesu eich gallu ieithyddol chi na'ch gallu chi yn y Gymraeg. Yr peth pwysig ydy bod ni yn trio anelu at yr amcan yma yn y pen draw, wrth gwrs, i gael fwy o feddygon a doctoriaid sy'n gallu trin trafod hefo cleifion trwy gyfrwng Gymraeg yn ogystal â'r Saesneg. Felly mae am wneud yn siŵr bod chi yn hyderus yn dwyieithog, nid yn Gymraeg yn unig.
Great, thank you. Sarah referred there to how much of the course you can do through the medium of Welsh in Cardiff, and for people not to think that when they succeed in using their Welsh language during a course like medicine, it doesn't mean that they're only qualifying in the Welsh language element of that course. It's a means of communication and for people to have confidence in using the language. Diolch yn fawr i ti, Sarah. Now, Lauren, you've kept quiet, we've kept you quiet. Did you do all that research? What did you do? What was your journey?
Oh, I would say that I think I would just want to emphasize making sure you know what the university that you've applied for requires, because the difference at Cambridge is that instead of a UCAT score, they use a BMAT score. So it's important to know that you'll be doing an extra test that you need to revise for that as well. And then I suppose the other difference would be that there's, across universities, they have different styles of interview. So whilst many medical schools use multiple mini interviews, there's some universities such as Cambridge, you might have 1 or 2 longer interviews where you'll be talking with for 20 to 30 minutes in that interview. So I think that's something important to bear in mind. Find out what the university you're applying to requires of you.
Thanks very much, Lauren. And talking about, let's pick up on that interview that you talked about. Yes, things have had to change this year, but what advice would you give a student, a Year 12 student, on how to prepare for that interview?
Well, I would say the most important thing is to practice talking, whether that be to your friends, your family, your teachers, even just to yourself. Just practice talking about your subject, practice answering questions in a timed manner, and practice maybe talking through your thought process. So, for example, in your interview, you might get given a question that you don't know the answer to, but don't worry if you can't give the correct answer right away. It's not about that. Instead, just talk about your thought process. how you problem solve, and then the interviewer will be able to see how you go about solving a problem, and also might be able to encourage you if you're on the right lines or guide you in the right direction. So I'd say yes, practice talking through it.
Well done, you talked well through that, Lauren. Jonathan, from your perspective, what are the top tips on interviews?
Yeah, similar to what Lauren said, I think practice articulating answers. So if only with one of your school friends, just sit there and get them to fire some questions at you. You can Google questions. You just type into an internet search engine, interview questions, and you get a whole list of questions. And so get your friend to ask you some of those questions and just practice articulating an answer. And often there isn't a right or a wrong answer. It's being able to come out with something sensible and to be able to articulate it. And one of the key things we're looking for in the interviews is communication skills. So it is the way in which you are articulating that answer, and how coherent you are. And so this is why practicing the communication side of things is really quite important, because of course communication is so fundamental to for doctors and dentists and so on going forward.
Diolch, Jonathan. Dave?
Yeah, I kind of concur with what has been said, although I'm always a bit cautious about over-rehearsal. It's a great temptation to sort of do, as Jonathan and Lauren have suggested, go and research, the types of questions you may get asked, and sort of formulate an answer and then rehearse it to the point where it sounds like Channel 4 racing. And they're off, and it just gets lost in this sort of, and I think it's really important that you do what Lauren suggests, but do it in a mirror, do it with mates that you trust or other colleagues that you trust, to get them to give you critical feedback. What Lauren suggested is really important, because sometimes there are nuances in the question, because they all look a bit formulaic. It may be about ethics, it may be about how you work in a team and those kind of things, and you just assume that's the question. Sometimes there may be a little twist in the question. You go off on your little rehearsed bit and you actually miss the point, the really important point of the nuance of the question that was being asked. So whilst they agree it's important to get a good idea of what you think you're going to say, the other thing I would say is make it real. Because so often people will say to me, and I'm sure Jonathan and others are the same, Sarah, I know as a colleague in Cardiff, has sat through many, many interviews where, the question's about team working, and you get this really kind of dull response that is all about, I know the importance of team working because I watched MDT, blah, 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 and off they go. And the real point of team working is, tell me what it is that you do in a team and why you're good in a team. I know why I'm good in a team. I'm not the leader, I'm not the captain, but I glue the team together. I'm the kind of nodder, an enthusiast, and all that kind of stuff. And that's a really good skill to have if you're in a team. Clearly, there are roles that you will play at different times, but that's the argument I would make. Try and think about making your answers well exemplified with issues that relate specifically to you and your experience. Okay.
Just like you did there now, Dave. Thank you. Yeah. So, Sarah, you're part of the process at Cardiff. So is there an opportunity to be interviewed in Welsh?
Yes, there is. Yeah, you can sit your interview through the medium of Welsh, so you would select that. And, similar to what I was saying earlier, that doesn't mean that you have to do the whole interview through the medium of Welsh. You can swap between stations. You can swap in an answer even, really, if you wanted to. We're not assessing your Welsh language skills. We're just trying to make sure that you have the opportunity to speak and to give your answer as clear as you possibly can. And if that means speaking in Welsh or speaking in English, it's completely up to you. We won't say that we prefer you to do one or the other. It's completely up to you. So yes, we'd really encourage you to do that if you wanted to. So it's a bilingual interview, really, more than a Welsh one, unless you decide, of course, to answer all your questions in Welsh.
Menna, mae'n drwg gen i. Ydych chi'n rhoi rhyw gyngor arbennig I ddarpar-fyfyrwyr ar yr elfen gyfweliad? Do you give advice? Chi'n rhoi gyngor?
Ydyn ni, dweud y gwir, ar gynllun doctorate yfory a deintyddion yfory, mae gennym ni weithdai ar yr MMIs. Be da ni'n neud ydy rhoi cyfle, oedd Lorwn yn fanna'n sôn am ymarfer. Be da ni'n neud ydy yn y gweithdai yma, rhoi cyfle i'r bobl ifanc ymarfer efo'i gilydd, a ma'n gwerthuso ac yn rhoi adborth i waith i gilydd. A hefyd da ni'n dod â myfyrwyr cyfredol i mewn, felly maen nhw'n cael cyfle i siarad efo myfyrwyr sy'n newydd fod drwy'r broses, a myfyrwyr wedyn yn gallu rhoi tips iddyn nhw ar eu profiadau nhw a rhannu profiadau ac yn y blaen. Felly, os ydych chi'n rhan o gynllun doctoriad yfory neu deintyddion yfory, mae yna gyfle gwirioneddol dda yn y gweithdai i ymarfer.
It's great to hear there about workshop opportunities that the Coleg Cymraeg offers, where students get together and evaluate each other's responses, again, to build upon the confidence, I imagine, to help them for the projects that they'll be undertaking. Diolch yn fawr I ti, Menna, am hynna. And Glenn, you're the last on this one. So do you have anything to add on what you've heard from these masters here?
I mean, not really. I think it's all been said. The only thing I would say is I really heard Professor Dave's point about over-preparedness versus nerves. So I would say that preparation is really important for an interview, but then also so is learning what you can do to try and control the nerves that will happen. It is a terrifying process, even though they're looking to see the best in you and they're looking to find you on a good day. So, you know, if deep breaths and meditation helps, then give it a whirl. But I've nothing more to add.
Whatever's right for you. And you know what? Channel 4 racing is now never going to be the same again. Okay, a question now about, you've alluded earlier about the COVID situation and how things are different. So, what can young people do to supplement the lack of volunteering opportunities because of the COVID experience? Can I start with you, Dave, on that?
Yeah, it is a real challenge, and we understand it. We've just had this year's application round in, like probably colleagues around this table now, and I think the issue is how best to advise students in the situation. There's two things, and again, without labouring the point, if you go to the Medical Schools Council website, back in April, they wrote a document that described what students could do in terms of work experience and gaining experience in these times of COVID. So I'd encourage you to go there, because bedded into it are some really useful links. For example, the Royal College of GPs have produced a kind of some video footage of interactions between a patient and a GP, and you can look at that and interpret and see the interaction, what you think is good about it, what you think could be improved. So there's a genuine opportunity to do what you would normally do, but through a virtual environment. But I think it's not, don't get despairing about it. And medical schools are fully aware, and I'm sure Jonathan and others in the veterinary schools will all be aware of the limitation of opportunity that students have. The other thing I did do, though, Glenda, is just, and it bugs me a little bit, is that we want students to still try to get involved in volunteering and work experience. Not saying that they have to physically go out, but for example, over the media recently, there's a lot of very elderly people out there that have become increasingly isolated. You go on the NHS website, there is a good bit of narrative there about how you can go and get engaged with just having a phone chat with an old person who you may be the only person they've spoken to that day or perhaps even that week. And so therefore there are opportunities, and I would encourage anybody out there to still think about doing the things they would normally do, but perhaps in a virtual way rather than a face-to-face way.
Thank you, Dave. And in terms of dentistry, Jonathan, what would you say to young people?
Yes, well, likewise with the current cycle, we're not expecting evidence of having been into practices and got work experience, because we appreciate that that's not going to have been possible. Yes, voluntary work, as Professor Wilson said, there's lots of sort of things you can do via phones and so on. So you can do voluntary activities remotely. But one of the reasons that we normally in normal times ask for work experience is for applicants to be able to demonstrate they understand what a career in dentistry is all about. We don't want people entering the profession and then quitting after a couple of years because it wasn't what they thought it was going to be. And so we want to make sure people are coming into the process with their eyes open. They know exactly what the good bits are and the bad bits are, etc. of a career as a dentist. And so there are other ways that they can find that out. So again, as Professor Wilson mentioned, there's there's a lot of websites out there. So, for example, the BDA, the British Dental Association website, indemnity providers, so the people that provide cover, litigation cover and so on, such as the MDU, Medical Defence Union, for example. There's plenty of other ones. The GDC, the General Dental Council, all of these types of bodies have websites. And you go onto those websites, there's a huge amount of information on those websites that can be read and absorbed, and as part of the process of getting to learn about the career and what it entails. And so that would be my suggestion, is to do that reading, that research, online and so on, because it won't be possible in current times to actually go physically into a practice and observe.
Diolch yn fawr, Jonathan. I have to know, Lauren, what did you do for your work experience, volunteering experiences when you were that age?
Well, at the time, I had a work experience week at Ysbyty Gwynedd, actually, and it was a really good opportunity to just see what life as a doctor was like, and to visit lots of different departments, and to find out all about the different specialties. It was a really brilliant week that brought a lot of people from schools across North Wales together, and we could share our thoughts on medicine and applying, and practice some interviewing.
And obviously, and also, sorry, carry on.
Oh, I was going to say that I also volunteered locally at Ysbyty Gwynedd, but I suppose at the moment, like as Dave said, there's fewer opportunities like that. But if you do Google telephone volunteering opportunities, there are so many charities in the UK at the moment that do offer this, and you can become a friendship volunteer, and you can just be there for people who might be feeling lonely, especially if they're in isolation or quarantining, and they just want to have a chat.
Well, you took the question that I was going to pose you out of my control and answered it before you were even asked it there, Lauren. Thank you for that. Again, those links in, people who are tuning in, it's great for you to be aware of these, act upon them. They're there to help you in your journey and in your pursuit of whatever you want to study. Anything you want to add there, Glenn, because you cover the 3 disciplines in your admissions role?
Only to say that I think the previous speakers have brought out that there are a couple of things being addressed by the work experience. One is that you have got a realistic idea about what you're letting yourself in for. It's competitive, but it's also hard. And so trying to show in whatever way you can that you're aware of what's involved is really important. But equally, some of the other things, they can, you can look back into I don't know, being in the school orchestra or things you have done in the past to find the transferable skills. They might not be as good and as convincing, as compelling as in a clinical setting to show your communication skills, your empathy, your teamwork. But nonetheless, they're still the things we're looking for. And if you can combine some volunteering online and also, transferable skills from other things you've done, that will be convincing. Dentistry and veterinary schools have always tried to have reasonable expectations of what a teenager can actually do to prepare themselves for these very challenging careers, these rich and rewarding careers, but challenging. And so I suppose the message is nobody is trying to catch you out here. There are various ways you can skin this particular cat, for the vets there, but we're not trying to make it impossible. Everyone is trying to find ways to see the best and to see your suitability.
Brilliant, thanks Glenn. Mennai, o safbwynt y Coleg Cymraeg, beth yw'ch cyngor chi o bobl ifanc yn y sefyllfa yma? What's advice you giving young people at the moment?
Diolch, Gwenda. So ni'n licio cyfeirio bobl ifanc at lawrlyfr mae Prifysgol Caerdydd wedi greu yn gynt yn y flwyddyn, Thinking of Applying to Medicine. A dwi'n meddwl bod o ar y website Hope. A mae'n rhestr gwych o podcast o ddiddordeb, o lyfrau o ddiddordeb, o websites o ddiddordeb. So mae jyst y rhestr gwych o bethau allwch chi wneud i wneud yn iawn am y diffyg profiad gwaith. Fel darllen, mynd ar podcast, a mynd ar websites o ddiddordeb ac yn y blaen. A so ni rili yn argymell y llawlyfr yna, Thinking of Applying to Medicine. Mae'n fawr o wybodaeth, dweud y gwir.
Great. And when I was just telling you young people there about the brilliant booklet, as she said it, I'm not commissioned, by the way, about Cardiff University's booklet, to advise you again to think carefully about what you want to do and why, and that she's found that you're suggesting that the Welsh language students refer to that booklet. Sarah, were you part of devising that booklet, I wonder?
No, I can't say I was. I can't take any of the credit for that. It was made in Cardiff University, though, and it is available in Welsh and English, so it's not exclusive to Welsh language students. But it is really, really useful, and it does have a lot of information there and a lot of ideas, and it is about kind of thinking outside the box and thinking of what you can do. But more importantly, what I would say is to think about what we're looking for. So why do you need work experience? We're looking for somebody who has an insight into what a career in medicine is like. We're looking for someone, who can show a caring attitude towards others. So try to think of those key attributes that you're looking for in a doctor, and that's the reason that we're asking for all of this experience. So try to think of it from that side, I would say.
Gwych, diolch yn fawr I ti, Sarah. What's arising from this conversation now is wondering, if there's a student out there thinking, but I don't know whether I want to do dentistry, medicine or veterinary science, which should I choose? Glenn, you cover the three, so I'm going to pick on you first this time. What would be your response to a student who needs that advice?
I mean, it's a really good question, and it does happen that we have someone saying, I'm choosing between two. They're generally not stuck between three. I don't know why, but often choosing between two is a real challenge. And sadly, the best answer is relates to the work experience, because getting as close, I always say that in terms of making a good personal statement, even though we don't score it at Bristol, that you're essentially writing an essay to convince someone that you would make a good student of whatever that subject is. And so the case you're building to say that you would make a good candidate is to show some understanding of what's involved, the challenges that are involved. I mean, I know that with veterinary science, the classic distinction that always comes up between veterinary nursing and veterinary science is that if you want to, cuddle and look after the animals, you probably are going to be horrified by some of the other sides that are involved with administering treatments and possibly euthanasia and so on. I mean, it is just a case of trying to get yourself as aware as you can of what's involved, sort of warts and all. That does become more challenging now, but the other speakers have mentioned some fantastic resources that you have, and I think it's also really helpful to talk to people who know you, talk to the teachers who know you well at school or college, and also if you're lucky enough to have doctors, vets, or dentists in your family and social network, then reach out to them and ask if you can interrogate their experiences of what the career is like. They might know you as well, and if they're good friends and family, they might well say, well, what you would be great at would be X, and what you might struggle with would be Y. Choosing between them can be really difficult, but I think everything you do to make a strong application that shows more understanding of the course, more understanding of, would it involve a cadaver? Would it involve much practical work? What are the hours like? What's the workload like? What would you be doing? What would your clinical experiences in the first year like? Those kind of things should help you figure out which one will suit you better and play to your strengths.
I'm not going to play the game here now on whether medicine or dentistry is the best, but what would be your advice, Jonathan, to dentists of the future?
Yeah, I mean, there's obviously a lot of similarities between dentistry in medicine, particularly the fact you're working, interacting with the general public. You've got to enjoy working with people and interacting with people. One of the key differences, of course, that jumps out is the nature of what's being done on a day-to-day basis. I mean, most dental students end up in general dental practice, as opposed to, say, the hospital sector and so on. And within general dental practice, of course, you're basically treating the patient. There's a lot of manual dexterity needed. You're doing very fine little bits and pieces within someone, within a very small part of the body, within the mouth. And so you've got to be someone that likes using the hands, that enjoys that side of things, as opposed to, I mean, I can't talk medicine. I'll let Dave come in on the medicine side of things, but I would imagine a lot of work of general medical practitioners involves sort of the consultation side of things. Whereas, as I say, with dentistry, it's about the hands-on side of things. So that's probably the big thing to take on board and ask yourself, well, do I want to spend most of my waking hours, doing that, doing the manual stuff? That would be my big message, I suppose.
And you've handed the baton over beautifully today there.
Well, I think it's an interesting one because I think both Jonathan and Glenn have raised really important issues in terms of making that decision and what goes into that process. The one thing I would say is don't rush, because if you rush and make the wrong call, it's very hard to get yourself rerouted to perhaps the route that you then discover that's the way you want to go. So I think that my first argument would be talk to as many people as you can. I think Glenn's advice is very good. It's about skill sets. Like Jonathan said, there are some people who are brilliant with their hands and used to working in close environments. A lot of my colleagues are orthopedic surgeons, and it's a bit kind of hammer and chisel job. It's a bit sort of knuckle dragging at times. But the fact is that there are different skill sets required for each of them. What you can't do is perhaps gauge all of the spectrum of opportunity. I think Jonathan said at the beginning, you're a wire bender, you're an orthodontist, yeah?
Prosthodontist, so about false teeth.
Oh, prosthodontist, yeah, false teeth, okay. But even within dentistry, there's these subsets that are extremely important, have huge reward for the individuals that are doing them. A very good friend of mine is an orthodontist. And he showed me some of the things he's done with rearranging people's teeth and giving them such an amazing look. I'm suffering with a hip at the moment, and I just love an orthopedic surgeon to come my way and give me a hip replacement. But in the current time, it's not going to happen. But the one thing I would also say, and I've read it a lot, and I'll let the others talk in a minute. But the one that I would say is, a lot of people say, well, talk to your GP or talk to your dentist. And the number of kids that tell me not to do it. Their usual advice is don't do it. So maybe that's not always the best place to start. But you've got to research. The other thing I would just say briefly, Glenn, and I think it is an important thing to say. Glenn suggested you could use your contacts and stuff. And we know in Wales that's a particular problem. That the whole process of work experience is ad hoc and favours people with connections. And as soon as you say those two things, you then can't use it in a meaningful way as a criterion for deciding whether someone should come into that course. So we're fairly easy-ozy about it. And I think many med schools these days, and particularly now COVID hit us, we're less concerned. We still want to, as Glenn's rightly said, we still want to know this person wants to follow this professional route, but we do appreciate that it's very difficult to get the kind of experiences that you may want to get.
Thank you, Dave. Ond dan ni'n gwybod bod cymorth yna. We know that there is support out there. I'm going to go to Lauren. So how did you decide? And were you thinking, is it this, is it that? How did you decide? We've only got a few minutes left, but let's hear that.
Well, I found it really difficult to choose between medicine and biomedical science. But after gaining work experience at the hospital and also having experience in a lab, I knew I wanted to be a doctor. So my advice would be to gain as much experience as you can, although I understand this must be really difficult at the moment. But if you can research the careers, find out what they both entail, and maybe make a list of what are your interests, what are your values, what do you want from a career, and then think which just seems the most exciting to you and the most interesting.
Thank you, Lauren. Y gair ola i'r Gymraeg. We'll get the last response in fel. Sarah, rhywbeth ti ychwanegu at hyn?
Byddwn ni jyst yn deud bod o mor bwysig gwneud yn siŵr bod chi yn gwneud eich gwaith cartra. Y bydd gorau is ydych chi'n ansicr, ydy just cario ymlaen I holi chma. Ac os ydych chi ddim yn siŵr lle I droi, mae yna gymaint o gymorth trwy'r Coleg Cymraeg a trwy'r prifysgolion. Fydd pobl o hyd yn barod I roi cyngor ac I helpu chi, a fydden nhw eisiau rhoi mwy o wybodaeth I chi am y cwrs I wneud yn siŵr bod chi'n gwybod mai hwnna 'di'r cwrs I chi. Felly peidiwch â byth bod yn ofn estyn allan a gofyn i bobl am help, achos mae'r gymorth yna fwy nag erioed rwan.
Gwych, Sarah. Sarah was just explaining almost where Menai started off, saying about the importance of seeking help. Doing your research and seeking help. Unrhyw top tip arall, Menai? You got that in English, didn't you? Top tip is top tip today in Welsh and English. Menai, rhywbeth arall y ti eisiau chwanegu?
So ni'n dweud, cynllun doctorau dyfory a deintyddion yfory, be da ni'n neud? Da ni'n dod â bobl o'r ddau broffesiwn i mewn i siarad efo'r bobl ifanc. Felly maen nhw'n gallu holi nhw am eu bywydau, am eu gwaith. Felly erbyn diwedd y ddau gynllun yna, mae gen y bobl ifanc syniad eitha da o be mae'r swyddi yma'n ei olygu. Felly os ydych chi'n ar y ddau gynllun yma, mi ydych chi'n cael mor wybodaeth am y gwahanol swyddi a be maen nhw'n ei olygu ar lifestyles a hyn i gyd. Felly mae yna gymorth fel o Sarah yn awgrymu, mae yna lot o gymorth ar gael.
Ardderchog, talking there about the Coleg Cymraeg's tomorrow's dentists, tomorrow's doctors, and by having that resource and conversations about that, hopefully it helps that decision process. Our time is up. We talked about the importance of communication, showing empathy and being clear about things and not being too generic in our responses. You definitely haven't. Felly, diolch yn fawr iawn i chi gyd. Really grateful to you all for this afternoon. Diolch yn fawr. Hwyl fawr.
Diolch.
Hi.
Wow, diolch yn fawr i'r panelwyr. Thank you to our panelists for those insights. I hope you found them useful. It's now time for your second information, advice and guidance session. Ewch nôl i'r lobby I ddewis. You'll need to head over to the lobby and choose which session you'd like to view. Y dewisiadau, the options are, applying for the creative industries, y diwydiannau creadigol. A session aimed at learners who wish to apply for courses across the expressive and visual arts. You'll hear from Animation Director James Lancet, Dave Jones from the University of Bristol, ac Abby Brackbull, Cardiff Metropolitan University. Yr ail opsiwn, the second option, is a live Q&A on understanding student finance, scholarships and bursaries, where you'll hear from Philip Lyons from Student Finance Wales, Iona Jones from the University of Bath, Rhian Griffiths o Brifysgol Abertawe, Swansea University, and Seren alumni Jack Bailey from the University of Cambridge, who are ready to answer any questions you have about managing the cost of university and what support is available to learners in Wales. Bydd rhain, these sessions will begin at 7:05 p.m. So ewch i'r lobby, head over to the lobby now to select your session.